Now again, good afternoon to everyone. Our discussion for this afternoon is related or as a continuation is all about common medication suffixes. Last time we ended up with the discussion on the coverage of the pharmacokinetics, which is absorption, distribution, metabolism, and elimination or excretion. When it comes, we have also discussed, I think, the topics related to the rights of medication. And with the rights of medication, we have learned that this rights of medication may have trump. So we have the right time, the right route, the right action, the right medication, and the right patient as the 5 rights of medication. But we have explored and expounded it with the 12 rights of medication as being implemented here in the Philippines. Now, the 10 rights or the 12 rights of medication is very significant also because it has a legal imperatives on how we promote safety to ourselves and protection to ourselves and for the patients as well. Now, when it comes to the topic for today on the common medication suffixes, this will really guide us on how we will classify the drugs as according to the generic names. So let's start. So if we say cane, we have already started this with all drugs that ends in cane are considered as local anesthetics, and we have defined accordingly the difference between the local anesthesia, spinal anesthesia, and general anesthesia. Most of the anesthesias or anesthetics will be discussed when we reach the topic on the drugs affecting labor and delivery. But for now, most common medication suffixes that you may encounter are cane, which are classified as local anesthetics. So the difference between the local, spinal, and general anesthetics is that for local anesthetics, there are only specific areas that may consider anesthetic effect. And when we talk about spinal anesthesia, the anesthetic effect will be from the waist lower, okay, lower extremities. When we talk about the general anesthesia, this may probably affect the consciousness of the client because of the effect of the general anesthesia is usually the upper and the lower extremities. So most of the local anesthetics are being administered intramuscularly. And if it is intramuscularly, class, if you can still remember, the maximum volume that we could administer only for the intramuscular is how many ml? If you can still remember, how many ml is only the maximum volume that we could administer via intramuscular?
3 ml po.
Okay, so that's a maximum of 3 ml. So even though if it's a local anesthetic, don't exceed the 3 ml because it can only hold the amount or volume of the drug, which may basically consider the muscle. And if it exceeds 3 ml, it may cause the possibility of the irritation of the muscle tissues, and possibly may lead to the tissue death of the muscle tissues. So most of the drugs that ends in cane are lidocaine, bupivacaine, and lontocaine. Now, when it comes to the lidocaine, bupivacaine, and the lontocaine, this will basically consider the drugs that could be available upon the prescription of physicians that may only have the S2 license. The S2 license that we are talking about are being released or being issued to specific authority to an attending physician if he pass a specific examination to give him authority with the S2 license to prescribe regulated drugs. And anesthetics are regulated drugs. If we say regulated drugs, this could not be purchased over the counter, and this could not be prescribed by any physicians that do not have the S2 license. So the next drug that we are talking about is DONE, all drugs ending in DONE. So these are opioid analgesics. So as we discussed when we talk about analgesics, analgesics are drugs that merely consider the objective of pain relief. And if you have encountered drugs that are the drugs that you may heard about non-drowsy or drugs that may cause drowsiness, the opioid analgesic may cause drowsiness, and opioid analgesics also called as narcotic analgesics. Uh, the narcotic analgesic may have the direct effect or direct effect on blocking the pain receptors to the cerebral system or the brain. So that's why most of the opioid analgesics and narcotic analgesics are also regulated drugs that may significantly affect the consciousness of the client. So that's why it is greatly monitored by the nurse every time that a person or a patient will receive opioid analgesic. Level of consciousness is very much important to consider or to assess. Actually, class, opioid analgesics and narcotic analgesics such as drugs ending in "done" are also being prescribed by those physicians with S2 license, because opioid analgesics are regulated drugs. Kaya ang opioid sometimes these are drugs that may may affect specifically the consciousness of the client, and somehow this may cause also fatality to the client if taken on a higher amount or volume for the meantime. So again, let us continue. So again, there are various forms of distractions every time that we have live discussions, and that is merely part of every virtual and online discussions that we may have. So it's either the barks of the dogs or those sounds that may distract. But anyway, to continue. So to continue with our discussion, um as we said, and as we have emphasized when it comes to Dawn, so the opioid analgesics will merely is considered or are considered as regulated drugs, and the nurse must be careful when it comes to the administration of these drugs, because actually, since these drugs will direct its pain receptor blocking directly to the brain, if it is somehow abused or it will be taken on a higher dose from the prescribed, obviously this may, or overdosage, this may greatly affect the function of the brain, and specifically may affect the major systems of the body, from the cardiopulmonary. Kaya that's why most of these drugs are included in regulated, because these are the common drugs that are being abused. And since this is regulated, these are regulated drugs, nurses are also careful and consider specific responsibilities when giving this drug as an opioid analgesics. So next, we have discussed also the mycin or the MICIN, either of the two antibiotics. So we have erythromycin clarithromycin or azithromycin. So those drugs ending in mycins. Actually, class, when we talk about antibiotics, I know for a fact that you have studied this in your microbiology and parasitology, all about the gram positive and the gram negative. The gram positive, the gram stain test and the culture and sensitivity test are usually done to basically identify the cause, the common cause of the microorganism, specifically of a particular infectious or communicable disease. So that to have and to prescribe an antibacterial or antibiotics to target the specific uh, microorganisms such as the bacteria. But nowadays, we have the what we call broad spectrum antibiotics that may target the both gram negative and gram positive bacteria. Unlike for antibiotics that are considered as first generation antibiotics. First generation antibiotics may consider only that may target gram negative bacteria, and the others are gram positive bacteria. So actually, when it comes to these mycins, mycins are antibiotics that are being considered on the first and the second generation that may target only specific bacteria or microorganism. Unlike for broad spectrum antibiotics, from term itself broad, it encompasses both uh, the gram negative and the gram positive bacteria. However, when we talk about the mycin, since common drugs identify the erythromycin, clarithromycin, and azithromycin, usually it target those bacteria that affects the respiratory system most. Just like as what I have mentioned to you, the azithromycin are the common drugs being prescribed now to patients with COVID-19, but not for purposes of therapeutic and pharmacological management for COVID-19 since it's a virus, but the azithromycin is commonly prescribed to a patient with COVID-19 simply because if they are associated with pneumonia or bacterial pneumonia. So azithromycins, this most are given via oral or in a tablet form, and these are usually given 3 days to a maximum of 4 days. Actually, most of the mycins, class, remember this as nurses, most of the mycins that are being prescribed to patients are usually administered on full stomach because these drugs may basically cause gastric irritations. As our orientation when it comes to the administration of oral medications, that most naman may cause gastric irritation. However, most of the antibiotics that are really identified that may cause the gastric irritations are those drugs ending in mycin. So let us now proceed with the broad spectrum antibiotics. So we differentiated the mycins as the first to second generation antibiotics, but when we talk about the broad spectrum antibiotics, these are the drugs or antibacterials that may target, and its mechanism of action is merely to inhibit the growth of both gram positive and the gram negative bacteria. And those drugs that are classified with suffix of ending in oxazine. Okay, so levofloxacin, ciprofloxacin, norfloxacin. So usually, broad spectrum antibiotics that are being prescribed to patients are those with complicated infection. So either an infection that leads to a complication of extended infection. So yan, usually these are the drugs that are being prescribed. Usually pagka if there are urinary tract infection that may cause kidney infection or bladder infection. So there are simply intention na to cover extensively yung effect of the antibiotic, not just only affecting on one system but merely to protect also the other system, because somehow one complications of infection may lead to another complication of extended infection, could be damaging to the tissues. So moreover, the severe infection is also termed as anyone who knows what the medical term for severe infection. It starts with letter S.
Sepsis po.
Very good, sepsis. Once sepsis where usually most of the drugs that are being administered po for sepsis, yung mga higher level na of infection ay mga broad spectrum antibiotics na po ito. Moreover, if the infection itself will affect the perfusion or the circulation of the body in transporting oxygen, or probably it have also extended damage to tissues of the other organs. So somehow the broad spectrum antibiotics are being administered to these patients. Actually, for COVID-19, most of the broad spectrum antibiotics, aside from this azithromycin, levofloxacin is one that are being given also to patients with COVID-19. As based from my experience, not my experience, but I have witnessed, levofloxacin is given so that to specifically inhibit the growth of bacteria, kasi we have the upper respiratory tract, which is all which the virus is keep on damaging and having inflammatory process on the upper respiratory and also the lower respiratory tract. So yung extended inhibition of the growth of the bacteria and microorganism are being covered by the broad spectrum antibiotics. So usually the levofloxacin are being given through intravenous. So yan. So when it comes to infection, we have sepsis. If we have the severe infection and it will already affect the transport of oxygen to the various tissues of the body, that's what you call septic shock. If it is already septic shock, then that may merely affect major organs such as the brain actually. So broad spectrum antibiotics are the one being administered if there are already signs of sepsis. Next, we have the beer. All the drugs ending in beer are antivirals. Okay, so we have abacavir, aciclovir, adefovir. So any drug that ends, even if there are new drugs that will be released in the commercial market, but if these drugs are ending in beer, it's always antiviral. So now we have a trial for COVID-19 that are being done in the Lung Center of the Philippines, I think, and NKTI. So mononucleavir. So from the suffix of beer, you will be aware that it's antiviral, and it target obviously the SARS-CoV-2. So aciclovir are also being given to chickenpox. And chickenpox is the cause of the chickenpox is a virus. So even though it's an antiviral, the antiviral may control the specific control, and it may inhibit specifically the major complications that may be brought about by specific virus. Just like for chickenpox, usually for chickenpox, the most common complications are pneumonia. So the virus itself may be prevented to lead to a major cause of complication. So next po. Next are those drugs. But for the meantime, before I proceed, do you have any questions so far? Students, do you have any questions?
None po.
None so far. Thank you so much. So next, those drugs ending in din, or sometimes there are drugs, or these are ending in tidin. So those drugs ending in tidin are anti-ulcer agents, and anti-ulcer agents are those drugs also classified as H2 or histamine 2 blockers. Okay, now, before I have discussed already what beta receptors is. Di ba, beta receptors are the ones that transmit impulse, that transmit signals to lead to an appropriate action. So the beta receptor is the one that leads impulses to the heart to increase or decrease, to increase heart rate, which is the beta receptor. While the histamine 2, I'm talking about the histamine 2, the histamine 2 receptor is the one that transmits signal specifically on the action sa stomach. Okay, and this is the one that is responsible for the transmission of impulse if it will facilitate to increase hydrochloric acid or if it will limit secretion of hydrochloric acid. But again, setting this mind na pagka setting the concept of once every receptor such as the histamine 2 will be stimulated, it will basically transmit impulse to increase the hydrochloric acids. Just the same as for beta receptor, if the beta receptor will continue to be stimulated, it will increase the muscle contraction of the heart. So, sir, how about histamine 1? Histamine 1 receptor are identified most yan sa skin at saka sa upper respiratory tract, specifically sa bronchi. Usually yung histamine 1 are usually stimulated when there are already inflammatory process pagka, for example, may asthma, yan. Another example is allergic hypersensitivity or allergic reactions. Kaya usually, di ba, pag may mga allergic reactions, hypersensitivity reactions, ang mga binibigay ay antihistamine. From the term itself, antihistamine, it must inhibit the histamine 1 because the histamine 1, once there will be an asthma attack, when a person is exposed to allergens, usually ang tinatarget niyan yung airway passages, specifically the bronchi. The bronchi will be contracted and it will cause the constriction of the bronchi. So do you think if the histamine 1 will be stimulated and it will cause constriction of the bronchi, it will affect the gas exchange? Yes or no? Do you think it will affect the gas exchange? Class, are you still with
Yes
me?
po.
Yes. So if
Yes
it is,
po.
thank you. So if it is constricted, so it will affect gas exchange. So that's why the patient may have antihistamine or histamine 1 blocker. But if we talk about histamine 2, always take into consideration the histamine 2 receptor or the one that transmits signal is identified in the stomach. So just a typical example of hyperacidity. So for hyperacidity, these are common drugs, the histamine 2 blockers. So the impulse, the histamine 2 receptor are being blocked so that to prevent further increase of the acid level, such as the secretion of hydrochloric acid. So those drugs that are identified are ranitidine, famotidine, cimetidine. So any drug that ends in tidine are identified as histamine 2 blockers. Sir, what is antacid? Okay. Class, from the term itself, antacid, let's go back to your biochemistry and general chemistry. What property in the chemistry counteracts with acid? Counteracts with the effect of acid? What property? Di ba base? Am I
Yes
sorry?
po, base po
Yeah,
to.
base. So that's why to counteract the result of to counteract the acid, we have the base. To counteract the result of the counteract the base, we have the acid. So that's why when you encounter antacids, actually there are drugs that are considered as antacid because it counteracts effect of the acid level. Okay? So those drugs that may have in the generic name aluminum, magnesium. Okay, those drugs that may have aluminum and magnesium, example, most common example are aluminum hydroxide. I'm talking about antacid. Aluminum hydroxide, which is somehow we have magnesium hydroxide or milk of magnesia. So if there are some drugs that are being combined, or the generics that are being combined, aluminum hydroxide, magnesium hydroxide, plus simetico, those are mealox or maalox. So if you will encounter that, yung maalox. So these are considered as antacid. However, nurses, you need to take into consideration that when you are administering aluminum hydroxide, one of the side effects is constipation. Or if you will be administering magnesium hydroxide, one of the side effect is diarrhea. So that's why to prevent aggravation of condition, if ever the client experiences already constipation, so don't constipation at the same time experiencing hyperacidity, then don't administer a drug that has a component of aluminum because it may aggravate constipation because of the presence of aluminum. And aware tayo that when you are giving aluminum or antacid that has aluminum, side effect could be constipation. Similar also with the effect of magnesium, that when you are administering magnesium hydroxide to a patient with hyperacidity, and at the same time the situation of the patient is she or he is experiencing diarrhea, then and better withhold the drug because it may aggravate the diarrhea. So what may happen to the patient? You are inducing possible dehydration to the patient. So on the other hand, if the patient is having diarrhea, then much better give aluminum hydroxide. So if the patient has experiencing constipation, then better give an antacid of magnesium hydroxide so that it may not aggravate the situation. So those are antacids. Those are antacids. Ako, with my experience, I do have a problem or health problem before with the presence of gallbladder stones. And usually, when you will have this situation of gallbladder stones, it may kasi the gallbladder stones is the storage kasi ito ng ng fats yung mga excess fats that are not being utilized by the body. So tentative storage to. Pero once these fats, lalo na po for those who are fond of eating high fatty foods na hindi siya usually nasi-synthesize ng stomach, and it will be longer yung storage niya sa gallbladder. The longer that it will stay in your gallbladder, the chances that it will form as gallbladder stone. So because of that situation, there could be possibility that if, for example, it aggravates my hyperacidity that time because the gallbladder is not working in balancing the digestion. So what happened? It caused hyperacidity. I started to take magnesium hydroxide, aluminum hydroxide, but it's not tolerated. It's really not, it did not tolerate it as well. So probably I choose at the next level of the drug to prevent the aggravation of hyperacidity is I took histamine 2 blockers. So specifically ranitidine. But again, it still did not tolerate the situation of the hyperacidity, simply because if the gallbladder is really affected, it will further stimulate to increase hydrochloric acid kasi most common the gallbladder helps in the synthesis of the cholesterol, and usually the secretion of the enzymes are very significant to balance digestive activity. Pero because of the presence of the gallbladder stones, this may not resolve the problem with the hyperacidity. So higher level, on the higher level, it's not indicated here, those drugs ending in prazole. Okay. Omeprazole, pantoprazole, lansoprazole. So all drugs ending in prazole are classified as proton pump inhibitor. So what's the difference between the proton pump inhibitor and the H2 blocker? The proton pump inhibitor, it's already more focused on the secretion of hydrochloric acid. The histamine 2 is the receptor. But the one that really aggravates my condition that time is already dependent on the secretion of the hydrochloric acid. So that's why usually my hyperacidity was relieved with the proton pump inhibitors because directly it acts already on the inhibition of the production of hydrochloric acid. So again, we have antacids, magnesium hydroxide, aluminum hydroxide, pag nadidinig yung simeticone. So next we have gabascone, yan. Usually those are the antacids. Now, when we talk about the H2 blockers, these are the drugs that ends in dine, tidine, and if we talk about proton pump inhibitors, these are the drugs that ends in prazole. So if you will be asking of my present situation, I do not have any more gallbladder. So I had my operation last 2013, and I had laparoscopic operation of the gallbladder. So that's why, as what I've told you, if in the increasing age, if you're really fond of eating lalo na yung mga processed foods, at your early age it could be managed because of your active metabolic response. But for the age that could be higher than 26 years old, 28 years old, yan, going up, increasing age, the metabolic response could be slower than the usual during your teenage years actually. So learning experience. So what I'm now protecting now for myself, sir, how the cholesterol your how the cholesterol is being synthesized now by your body because you do not have any more the gallbladder, the liver. So that's why with this situation, I am high risk for the fatty liver. So I really need to manage the dietary intake. So for those who are on this habit, so manage it at early age. So next po, other than with the anti-ulcer agents, we have the LAM, okay, the LAM and the PAM. So those drugs ending in LAM and PAM. For example, LAM is midazolam. Yung mga PAM natin, lorazepam, diazepam, clonazepam. So usually if you're familiar with Valium, Valium is the brand name for diazepam. Diazepam is the generic name. Kaya if you will hear any drugs that ends in PAM or LAM, these are anti-anxiety drugs, or sometimes it is also called as anxiolytics. So again, I even mentioned this to you before. If we say mucolytic, lytic means to inhibit or to block. Pag anxiolytic, obviously, it prevents anxiety. So these are anti-anxiety agents. Class, nurses, be careful also when you are administering mga anti-anxiety agents. These are your usual drugs that are being given pagka if the individuals are already hostile, if the patient is already having too much emotional outbursts, if the patient is not anymore irritable, too much irritable, so that really affects her system function and physiologic response. Usually these are drugs that we are given tentatively, but moreover, if these are drugs that are on the list of regulated. Again, why regulated? Because these are drugs that may cause direct effect din to kasi since anti-anxiety, we're talking about neurotransmitters in the brain. And usually, if you're aware of the neurotransmitters, what is the common neurotransmitters sa brain natin that really balances our mood, that keeps our sleep with quality, it balances our behavior. Do anyone knows the neurotransmitter responsible for that? Starts with letter S. Go back to the nervous system. Starts with letter
Serotonin po.
very good, serotonin. So the one that is lacking when you're experiencing anxiety, the one that you are lacking when you're experiencing depression is serotonin. The higher neurotransmitter is dopamine. Kaya usually these drugs are being given for purposes to slow down, kasi yun nga yung purpose to slow down these neurotransmitters because of too much activity of dopamine, pero ang serotonin mo slow yung response. So it is known Filipinos have higher level of serotonin because we are the ones who survive in every tragedies and pandemics that we are experiencing now. So but anyway, for a nurse who will be administering this PAM and LAM, take into consideration first to check the vital signs, because eventually when any drug class any drug that will affect the brain, directly the brain. Ano yung mga, what are those drugs that I mentioned to you in this discussion that will have direct effect to the brain? Opioid Analgesics. When you are giving anti-anxiety drugs, always take into consideration the checking of vital signs. Kasi if too much or overdosage of these drugs, it will inhibit the balance of the brain to control the other major organs. Usually, cardiopulmonary is the one that are being affected. Kaya too much dose of it may cause possible fatality of the client. Next po is we have drugs ending in neum, not nuim. That's neum. We have neuromuscular blockers. So you've heard about blockers. If we say blockers, it blocks. Okay? Neuromuscular, so it involves the nerve and the muscle. So, are you familiar with Parkinson's disease?
Yes po.
Yeah. What are the common observations and features that are being manifested by Parkinson's disease? Usually, 'di ba, they have mga involuntary, common sa kanila yung mga involuntary movements, yung nagti-trigger yung involuntary movements which are not controlled. Kasi pag voluntary, obviously, we are the ones that can control it. Pero pag involuntary, these are the ones that may not be controlled. Ito yung may mga problems sa Parkinson's disease, wherein the nerve impulses are not being controlled. So that's why nagko-cause yan ng muscle spasm, and at the same time nerve tension. So pag nag-cause yan ng muscle spasm at nerve tension, doon nagko-cause na yan ng involuntary movements. So this NUM are being given to the client to control that. So any drugs ending in NUM, pancuronium, becuronium, rocoronium, so any drugs ending in pera lang ang meconium, ha, please. Please, pera lang po ang meconium. So we have pancuronium, becuronium, rocoronium, because meconium are being identified the first pustule of the newborn, di ba? You can still remember that. So but that is not a drug. Okay, now let us now consider the next drug, those drugs ending in statin. Okay, statin are those drugs that are considered as anti-hyperlipidemics. If you've heard about lipid, what comes to your mind? If you've heard about lipids,
Fats po.
fats, very good. So ibig sabihin, if fats, it's associated also with cholesterol, right? So these are the drugs that are being given to clients that are may have significant findings on elevation of the cholesterol level. So sometimes, and most of the sometimes your parents may share, anak, mataas yung bad cholesterol ko. Sana tumaas yung good cholesterol ko. Is there any such as bad cholesterol and good cholesterol? Actually, class, if you've heard about LDL and HDL, high density lipoprotein, HDL, LDL is low density lipoprotein. Class, before we have discussed about that these lipids and cholesterol fats are insoluble. So that's why most of this cholesterol are being encapsulated yan ng lipoprotein. At yun yung tinatawag nating yung lipoprotein na nag-encapsulate yan, nakapasok din yung lipid, tapos yan yung nakikerry ng cholesterol. Is there a possibility that these lipoproteins or lipids may dislodge in blood vessels? Is there a possibility that may cause obstruction of blood vessels?
Yes po.
Yes. And considering the definition of density, di ba, density, going back to the science, mass density is equivalent to mass over volume. So pag high density lipoprotein, it has the capacity to pre-flow pa yan. But pag low density lipoprotein, low density lipoprotein, these are the type of lipoprotein that carries these lipids and cholesterol na may chances, that have higher chances to dislodge in blood vessels. Usually nadidislodge yung mga blood vessels na yan sa blood vessels of the heart, blood vessels of the brain, that merely causes problem with hypertension and merely causes problem with stroke. So that's why for preventive measures, the patients are being prescribed with anti-hyperlipidemics and those drugs ending in statin. So probably you can relate to this and try to check within the family members kung sino ang may hypertension dyan, because most of the drugs that we are being discussed here now are, I assure you, some of them are really taking this, lalo na for those individuals who have high cholesterol. So these drugs, simvastatin, rosuvastatin, fluvastatin. So even any drug that you may encounter, any name that you may encounter, that these suffixes of statin will give you the idea that it's anti-hyperlipidemics. Now I just want to ask you, which part of the day could this drug be effective when it comes to time of administration? Is it morning, upon waking up in the morning, at the lunchtime after meal, or at bedtime? Which of the following time of the day could best administer this anti-hyperlipidemics? Is it upon waking up in the morning? Is it after meal, lunch, or at bedtime?
At
What do you
bedtime
think?
din.
Time po.
Yeah.
At bedtime po.
Okay, so what comes to your mind? Why bedtime?
Kasi po din if, di ba po pag bedtime, usually after, yun na po yung tapos na tayo mag-dinner. So,
Yeah,
pahinga na rin po nung katawan din natin after po
correct.
nun.
Yeah,
So, yun
kasi
po.
you're definitely correct. To have a deeper explanation on that, try to connect it with metabolic response of the body. Usually at daytime, we are all engaged into physical activities. Our metabolic response are active. So meaning if we eat foods that may be high in cholesterol or fatty foods, the body can still metabolize it effectively and efficiently because metabolic response are active. But if you try to consider full meal dinner time and you are about to sleep in few minutes or in few hours, this could lead you to a high risk. Why? Because chances that since after the dinner time wherein the slow metabolic response comes in, the cholesterol may not be synthesized and possibly it will be carried by the plasma. So the higher level of the low density lipoprotein will be carried to the plasma rather than it will be synthesized by the digestive activity. Kaya if you will notice, di ba most of your relatives, immediate relatives, and even your parents, they are being advised not to take full meal at night time because that's the time that our body is responding slowly when it comes to metabolism, at usually lalo na pagka may mga high fat yung food, this may probably raise yung chances kasi na hindi effectively masynthesize ang cholesterol. So that's why it's mostly advised once a day and at bedtime. Okay, so next po, we have drugs that are ending in ide. Ide. So IDE, ide. So tandaan natin, ide, glimepiride, glipizide, gluperide. So lahat ng may ide, DE sa uli, ide. These are oral hypoglycemics. So if we say hypo, obviously low, glycy meaning blood sugar, imia or imix, imia is referring to blood. So obviously, the drug itself, oral hypoglycemic, this drug are intended to stabilize, to control, to sustain level of blood sugar. So moreover, these are prescribed to patients with diabetes. So be very careful also of giving this drug. Moreover, if the patient is diabetic, this must be prescribed by the endocrinologist or diabetologist. Probably don't do self-medication because the risk of sudden drop of the blood sugar may lead to the possibility of death or fatality. Kasi yung pinaprevent natin dito, hypoglycemic shock. Kaya anything that comes to your mind and may encounter na merong shock yung medical condition, this usually pertains na it really affects na the circulation. At we all know that the circulation, its component, very important dyan, yung hemoglobin that really carries oxygen to the various tissues of the body. Kaya nurses, make sure that if the drug are being administered, obviously it must be described by the physician, but it must also take into consideration that you must assess first the patient. If the doctor will prescribe prior to administration of the drug to check the blood glucose test, then much better. But if it is not indicated to check the blood glucose test, you must be aware of signs of hypoglycemia. Because if there are signs of hypoglycemia, nurses, you can withhold the drug, because with your analytical and critical thinking, you can respond to the doctors that I withhold the drug because signs of hypoglycemia are observed, and chances that I will continue to administer the drug, this may lead to hypoglycemic shock. Then that's a very on point reason. Next po, I know you are familiar and heard about drugs such as steroids. Sir, our body is naturally releasing anti-inflammatory hormones. So ito yung mga cortisol. Yan, anti-inflammatory hormones yan eh. Ano pa? Sa COVID-19, cytokines. Yan, cytokines. Ang cytokines po ay mga anti-inflammatory hormones. Pero pagka if this cortisol and cortisone cytokines are not sufficient to control inflammatory conditions, then there could be an option to proceed to pharmacological management such as steroids. So steroids as an anti-inflammatory drug are being administered to clients, those drugs ending in zone. S-O-N-E. S-O-N-E. Dexamethasone, hydrocortisone, betamethasone. Class, usually, betamethasone is very much common that are being administered to a client who's having preterm labor and about to lead to premature delivery. So from the term itself, sir, what's the purpose of the betamethasone? Ang betamethasone is a steroid that could be very significant for the well-being of the fetus, of the baby. Why? Because since it's preterm and it's premature, usually the lung surfactant are not sufficient. So obviously, the baby may not manage his or her own respiration. So that's why betamethasone are being given sa mga possible preterm delivery dahil this is to protect the baby, to increase the surfactant and have the lungs, to have a strong lungs, to have the independent respiration in the extrauterine life. So that is betamethasone. Usually naman, hydrocortisone are being given to patients with pulmonary infection and at the same time mayroong inflammation. So I may connect one. COVID-19 is one. And because of the virus, it may damage the airway passages, so may inflammation. So that's why hydrocortisone are being given. So ano na yung mga drugs that we have associated with COVID-19? Clients may have azithromycin, clients may have levofloxacin, clients may have hydrocortisone. Because ang action obviously ng azithro and levofloxacin, these are antibacterial to prevent the existence of pneumonia. Hydrocortisone naman, ang purpose nito given to the patient with COVID-19 is because of the body cannot respond to the inflammatory process to prevent continuous and extensive inflammation. So hydrocortisone. So yung dexamethasone can be also given to any systemic inflammatory organ inflammation, either heart, brain, blood vessels, even for the lungs. Dexamethasone may be also given as an alternative for hydrocortisone. So class, have you heard about that steroids are being given intramuscularly?
Yes po.
Yes po.
Which is not supposedly the appropriate administration. It must be given intravenously to target its desired effect for inflammation. Pero di ba some may have the injectable hydrocortisone to muscles kasi di ba yon nagko-cause siya ng increased muscle cell size. So that's why it's not advisable. If you've heard about steroids that being given intramuscularly for those who may have the objective and goal to have strong muscles, chances in the future, if this is not the proper study of the drug that must be given to the client, that may risk to the possible damage of the muscle tissues. So if you have been offered, for you, if you want to be muscle man, then you have been offered to have the steroid injectable, don't ever attempt to accept because of the chances that it is not based from the drug literature that it must be given intramuscularly. Okay? So, steroids, oral steroids are being given if it is or class never po consider high dose of steroids as a maintenance therapy. Pag sinabi nating maintenance therapy, continuous. Why? Kasi too much steroids, higher dose of steroids will directly cause damage to kidneys. So yan naman ang pwede nating maging effect. So that's why the doctors may prescribe initial dose, then at the same time as it goes with the days, ibababa yung dose niyan because merely the kidneys supposedly the one that will prevent inflammatory process. So yung ating mga zone such as prednisone are supplemental pharmacological management lang until the kidney will sustain its action to prevent inflammatory process. Kaya that's why it's only temporary. It must not be given continuously. So there are some instances that in 3 days, in 4 days, in 5 days, the doctor may already discontinue the drug. But for those who may have situations like lupus, steroids are being given continuously but on a lower dose. Lower dose because usually they are high risk on these problems. But again, anything that could be overdose such as steroids, one of the damage that may lead is basically damage of the kidneys. Okay? So next po, we have the what we call diuretics. Okay, pag sinabi natin diuretics, class we have discussed about in the elimination about GFR. If you can still remember that GFR, yung glomerulofiltrate rate. If we consider the glomerulofiltrate rate, this is the means by which the kidney will excrete the waste products such as in the form of urine. So, ang diuretics po class, its purpose is to remove excess fluid of the body. We all know that the fluid balance is being regulated by the kidney. If the kidney cannot tolerate to remove too much or to remove excess fluid of the body, then let's have a drug that will induce diuresis. Kasi diuresis from the term itself is a medical term that will induce urination or removal of excess fluids. So those drugs, what are those examples, sir, ng indications why diuretics are being given? Enlarged heart or cardiomegaly. Enlarged heart, that's an indication that there is fluid retention in the heart. That's why it makes enlargement. So that's why diuretics are being given. So if sir, if the kidney, for example, usually the kidney regulates blood pressure. If for example the patient has hypertension and there is no urine output, kasi class, you may know that the kidney can still function to regulate blood pressure if urine output is of quality when it comes to amount and frequency. But the more that the client have the enlarged heart, tapos less frequent pa yung urination niya, there is a possibility that more retention of fluid is going on. Kaya that's why there are some instances, any signs you may apply this to situations like you've heard about in colloquial manas. Manas is different from maga in colloquial. If we say maga, this is brought about by inflammation. If we say manas, it is brought about by retention of fluid. So, moreover, if it's termed as manas in medical term is pitting edema, swelling brought about by accumulation of fluid to tissues. Yung non-pitting edema naman is swelling brought about by inflammation of tissues. So instances like if the patient may have pitting edema, which is an indication of retention of fluid, swelling due to the retention of fluid, the indication of giving diuretics is very much significant because that's a sign that too much fluid are being retained, and this could be harmful and it may cause pressure not to have the free flow of the circulating blood through that extremities. So those drugs are drugs ending in "-zide", chlorothiazide, hydrochlorothiazide, methylclothiazide, anything that ends in thiazide. And other one is anything that ends in "-mide", such as furosemide, torsemide. So actually, what is important here that you must know are the suffixes. You may not anymore focus on the sample drugs because this will really guide you. So dun sa "-mide", furosemide, chlorothiazide, so may thiazide, may mide at the huli, these are called as diuretics. Now, since it will induce urination, and possibly the excess fluid of the body will be induced to release through urination, is there a possibility that the client could be high risk for dehydration also when a person is taking diuretics? Yes or no? Is
Yes
there?
po.
Yes. So, di ba I even told you before na aside from the observable signs of dehydration, one that will really direct you that it will confirm dehydration through the 3 electrolytes. If you can still remember, it must test the 3 level of electrolytes in blood. Anyone can still remember those? What are those? The 3 electrolytes that must be tested, serum electrolytes that must be tested to attest or to confirm dehydration. Anyone? Anyone? What are those electrolytes if you can still consider? Oh, okay, I will tell I will mention 1 out of 3. Sodium. Yan, sodium. Can you enumerate the other 2?
Potassium.
Potassium is 1, and then the other one is the other one, what is the other electrolyte? 'Di ba pag salt, kung may sodium tayo, may
Fluoride po.
chloride. So the three common electrolytes that are being measured, that being tested to attest problem with electrolytes are sodium, chloride, and potassium. But most common, if the patient has is taking diuretics, the most common that may really cause dehydration is low level of potassium. Be careful. If the patient is taking diuretics tapos it has already low level of potassium, you must be alert. You must be alarmed. Kasi we all know, we discussed intracellular and extracellular compartment. Sa extracellular compartment, nandiyan ang sodium chloride. Ang potassium is in the intracellular. So ibig sabihin, in the intracellular, the potassium is being excreted out of the intracellular. Is there a possibility that it may lead to tissue death kung yung potassium na from the intracellular are getting out of the compartments of the cell? Yes or no?
Yes po.
Yes. So if that happens, that may cause the possibility of dehydration na. So class, always remember, check level of potassium, or to prevent the problem with hypokalemia. Hypokalemia is the term for low level of potassium, serum potassium, hypokalemia. So if the patient has, to prevent hypokalemia, the nurse must definitely advise the client to take potassium rich foods para to prevent the what we call problem with potassium while taking diuretics. Next drug are those drugs ending in pril. Okay, pril. Except April, yearly na lang yan, April. So pril are so-called as ACE inhibitors. Actually, ACE is considered as mnemonic. Okay, ACE. What does ACE means? A is angiotensin converting enzyme. Okay, here comes the point. If the patient is taking pril, class, these are antihypertensive drugs that will identify that the kidney is not anymore responding in regulation. Kaya involved na dito si kidney eh. Involved na si kidney. It means that if the client will be prescribed with pril, yan, we are already monitoring the function of the kidney. So, what happens? Ano ba to? So, ano ba tong ACE inhibitor, sir? Yung angiotensin convert. Ano ba yung angiotensin? This is what happens. Kasi usually, 'di ba, pag may hypertension, we are aware the kidneys are the ones that will release adrenaline. The adrenaline signaled, will transmit impulse by beta 1. Tapos, di ba, it will help the heart to contract. So, if it will help the heart to contract, it will regulate the blood pressure. Now, here is the problem. With this process, once the adrenaline is released, angiotensin 1, renin will be released, angiotensin 1 will follow, at ang angiotensin 1 po is the one that will cause constriction naman will cause constriction of the blood vessels of kidney. So do you think there could be a problem na pag nag-cause naman ng constriction of blood vessels sa kidneys? The answer is obviously yes. Kasi if the kidneys will have the constriction, so it will compromise the circulation of the kidney, it will inhibit or limit the compensatory mechanism to regulate blood pressure to the heart. And somehow, if it will continue, chances naman na ang kidney naman ang mag-fail at soon will follow yung heart. So on that matter, we need to prevent the enzyme such as yung enzyme that we are talking about, angiotensin converting enzyme, because it must not lead to conversion of angiotensin. At yung angiotensin po is the one that causes constriction of the blood vessels of kidney. So that's why pril are given. Captopril, isinopril, enalapril. So any drugs that are given pril. Usually nga ito yung mga drugs din na binibigay pag if the blood pressure is obviously 160/100 kasi ano na talaga yan hypertension stage 2. Captopril are being given already because that's the higher class. Ito po tandaan niyo the higher po the higher the level of the blood pressure, the chances that the kidneys are not responding to regulate blood pressure. Kaya the next one that you need to consider, if the patient has hypertension, monitor the function of the kidney because that will follow. Hypertensive patients may risk problems with kidneys as well. So next, I'm sorry. When it comes to the next drug, so we have what we call drugs ending in pin, or actually dipin. Dipin nga usually to dipin. So may amyl, dipin and amyl. Anyway, let's focus first on dipin. Those drugs ending in dipin are calcium channel blockers. Sir, why do we need to block the calcium? We need to block the calcium simply because ganito po yan. Class, for example, excess alcohol in blood. If there will be excess alcohol in blood, what happens again to the blood vessel? Constriction or dilation? If increased level of alcohol in the blood, constriction. Correct. So can you imagine that the alcohol will induce constriction? At yung constriction of the blood vessel ba may create pressure to the blood vessel? Yes or no?
Yes po.
Yes, kasi once it will cause constriction, it will cause friction on the endothelial lining of the blood vessel. Here comes the point. So if it cause constriction ba, it will affect the flow of blood. It will affect by the flow of blood. Yes. So, and we all know that circulation must be continuous. So, what happens? Nag-smoke pa siya. O the nicotine is a contributing factor to constrict further the blood vessel. So, lalong nagko-cause yung friction and pressure and inflammation to that. So, the one that are being released sa blood vessels para ma-prevent yung continuous constriction is calcium. So sa blood vessels, nagre-release ng calcium para to prevent the constriction. Sir, di ba? Bakit naman po umiinom naman po ako hindi naman po nagko-constrict yung blood vessels ko, hindi naman po ako nahihirapan huminga. It's because of the release of calcium. The calcium that is being released on the endothelial tissues ng blood vessels ay nagsustain ng dilation of the blood vessel. However, if you will still continue drinking alcohol and you will still continue more sticks of cigarettes, you are taking risk, okay? You are taking risk to continue release of calcium. So release ng calcium kasi I need to keep the blood vessels dilated. Keep blood vessels dilated. Alam niyo po, there's somehow a harm effect din pag too much release of calcium. Ang too much release of the calcium po, class, will have its effect na pwedeng mag-cause siya ng decalcification. What do you mean by decalcify? If it will cause decalcification, it may cause hardening of the blood vessels. Yan yung problem. Alam natin yung cause. The cause is too much alcohol in the blood, the one that causes constriction, pero here comes the calcium that impose a compensation lang to dilate, but the problem is that of too much calcium itself may cause the hardening of the blood vessels. Class, the term hardening in medical term is sclerosis. Sclerosis if we talk about hardening. Now, kaya if you've heard about arteriosclerosis, so what does it mean? Sclerosis is hardening of the arteries. Arteriosclerosis. At usually, if these are the conditions that may happen to the patient, class, this may lead to problem with chest pain. At usually, chest pain are associated with insufficiency of oxygen. Kaya, ito very much common ito sa mga patients din with hypertension to sustain yung dilation din ng blood vessel. So these are drugs ending in dipine, pelodipine, amlodipine, nifedipine. Nifedipine can be given also sublingually to have a fast action on the management of the hypertension. So yung amyl, one of the example that ends in amyl are verapamil. Okay. Last suffix. The last suffix could be olol. Okay. The olol are the drugs that basically metropolol, propranolol, atenolol. So those are beta blockers, and I even mentioned to you that when it comes to the beta, these are receptors that transmit impulse to the heart. So if too much naman yung pag-release ng adrenaline, too much din yung signal na ita-transmit ng beta receptor, too much din ang magiging workload of the heart. If too much ang workload ng heart, it may cause increased consumption ng oxygen. So baka naman mag-increase ang oxygen demand. So magmamanifest yung chest pain. So that's why these are most common also given to patients with palpitations. So that to stabilize the contraction of the heart to its level that may not consume too much oxygenation. So these are the common medication suffixes, so that whenever we'll proceed to the succeeding parts of our discussion, it will give you already the idea. And I know for a fact, if you have watched the video of the common suffixes, this will really give you a guide on how to classify the drugs accordingly. And I know that you have answered our asynchronous task. I hope you have learned the importance of common medication suffixes. Okay, to continue. We are now on the pharmacodynamics. When it comes to the pharmacokinetics, we have talked about movement, but if we talk about pharmacodynamics, we are already talking about the mechanism. If we say mechanism, di ba, when we talk about the pharmacokinetics, it ended up to the plasma. Pero if we talk about the pharmacodynamics, this will already consider biochemical and physiologic changes. This is already an evidence by which the response of the drug is taking place in our physiologic in its physiologic effect. Kaya usually pag we mention about side effect, adverse effect, toxic effect, these are already associated with pharmacodynamics. This is because this already manifests yung response ng body natin sa drugs. So nadidistribute na kasi siya to the major organs of the body. Kaya that's why biochemical, because the chemical properties of the drug are already reaching the cells and tissues of the target organs. Pag physiologic changes, these are already targeting the major organs of the body or systems of the body to target its effect of the drug. Now, when it comes to the pharmacodynamic events, I have already introduced to you kung ano yung mga receptors. Yung beta receptors, histamine receptors, those are the common receptors that I have already introduced to you. Meron pa nga po alpha receptors. Ang mga alpha receptors naman, the action nito ay sa blood vessels. So alpha receptors, beta receptors, histamine receptors, these are the receptors that you may encounter in some or in most of the drugs. Kaya actually the nervous system, the nervous system per se is very relevant when it comes to the orientation of pharmacology, because it will really guide us on how to further understand classification of drugs. Somehow you may encounter these terms, agonist and antagonist. Even in movies, when you encounter antagonists, these are the ones that will control the success the success of the bida. These are the ones that will definitely contradicts the intention of the bida in the movie. Kaya that's why ito yung mga kontra, ito yung mga nega, so antagonist. So the terms, if we say antagonist, the terms that can be associated here are terms lytic, block, inhibit. Kaya pagka, if you were heard about antagonist, lytic, inhibit, blocker, common is to block, to inhibit. So common, associated, synonymous to each other. If we say agonist naman is a term that is being used to stimulate, to promote, to induce, so to facilitate. So those are the drugs. Kaya pag sinabi nating histamine 2 antagonist. So ibig sabihin yung antagonist inhibits the action of histamine 2. If we say naman histamine 2 agonist, na wala namang drug na ganon, histamine 2 agonist, these are drugs that stimulates histamine 2. So those are the difference of the using agonist and antagonist. Okay? Okay, class. I know. Okay, let us calm down. Sir, what a nervous system that you're introducing to us. We are done with anatomy and physiology. Pero class, I wish to assure you that once you will be familiarized with parasympathetic at saka sympathetic nervous system, class, these are very basic concept that you must know, because this will really guide you in all the drugs that you may encounter, because somehow most of the drug mechanism of action of drugs are anchored already with sympathetic and parasympathetic. Actually, these are under the autonomic, di ba? Autonomic nervous system. And with this balances the body response natin if ever there are some imbalances that are happening physiologically and may cause harm to the body. So this will preventive yung response naturally by our nervous system. So let us now proceed with the details. So let us now consider the difference between parasympathetic and sympathetic nervous system. Okay, if you can still remember the fight or flight, if you can still remember the fight or flight, yung fight or flight are associated with sympathetic. Okay, fight or flight, sympathetic. Sympathetic are also called as adrenergic. Kaya pag minention natin yung adrenergic drug, it usually initiates action of the sympathetic nervous system. So Parasympathetic naman is also called as cholinergic. Kaya if you will encounter drugs such as cholinergic drugs, it means that it initiates action similar to parasympathetic nervous system. So, let us now proceed with major neurotransmitters. For major neurotransmitters, the major neurotransmitters for sympathetic nervous system is norepinephrine. For parasympathetic nervous system, the major neurotransmitter is acetylcholine. Again, I will repeat. For sympathetic nervous system, it is also called as adrenergic. And the major neurotransmitter is norepinephrine. For parasympathetic nervous system, it is also called as cholinergic, and the major neurotransmitter is acetylcholine. Uh, Class, I think we don't schedule. Do I schedule the quiz?
Yes po, sir. Meron pong naka-schedule sa VLE po.
Okay. So that is supposedly Friday, but I scheduled it 25. I scheduled it 25?
Today po, October
25? Okay, sige. So probably baka nga siya mag-open. But anyway, maybe we will stop first in our discussion. So probably I may apply the 15-minute break now. So we will resume our discussion at 7 o'clock. So I will just manage to change the time, the date rather, that is supposed to be administered this coming Friday. So be back at 7 o'clock. Let's have your health break, hydrate, and meet your physiologic needs as well. Thank you so much. Thank you very much for the reminder. So we'll go back at 7 o'clock. So again, good evening. So let us continue with our discussion. So I ended up with the discussion on the significance of the nervous system. Parasympathetic nervous system, as what I had mentioned, is also called as cholinergic, and major neurotransmitters are acetylcholine. For sympathetic nervous system, we have the adrenergic, and the major neurotransmitters are norepinephrine. Now, why I need to emphasize this? If the drug is identified as adrenergic, as actually the sympathetic response is the natural response. But if we will talk about the drug that will mimic the action of sympathetic nervous system, it is called as sympathomimetic. So kasi the sympathetic response is the natural response of the body, physiologic response of the body. If it is sympathomimetic, it is associated with the administration of drug. So the term itself, mimic, the action the action takes place similar to the natural physiologic response of sympathetic nervous system. So if we're talking about drugs, sympathomimetic, same as if the drug mimics the action of the parasympathetic nervous system, it's parasympathomimetic. So let's have an example. One of the example that we may give is during emergency is epinephrine. This is usually administered when the patient experiences cardiac arrest. And once the patient had been brought into the ER, and the nurse will prepare for CPR, and one of the drugs that are being prepared is the drug epinephrine. The drug epinephrine is considered or classified as adrenergic drug. If it is adrenergic drug, these are the actions that may cover the action of the adrenergic, because we have mentioned adrenergic is associated with sympathetic response. So when the epinephrine will be administered, it will take an effect when it comes to acceleration of heart rate. So it's adrenergic drug, it will accelerate the heart. It will increase the contraction of the heart. Now, when we talk about the sympathetic response, the other effect of epinephrine is it relaxes also the bronchi. Kaya that's why when the heart will be stimulated to pump because of the administered epinephrine drug, it will also open up the airway passages so that, di ba, the ambu-bagging is being done. So is being done to the patient so that to facilitate supplementation of oxygen. So that's why one of the effect of the epinephrine also is it may open the airway passages, specifically the bronchi. So the epinephrine may have action also at the same time, not just only for the heart, but also for the bronchi. So another example is anesthesia. So we have talked about anesthesia. Example, drugs that are administered as spinal anesthesia. So we have mentioned that spinal anesthesia will have its anesthetic effect from waist to the lower extremities. And most of these anesthesias, except local most of the anesthesias, epidural, spinal, general, are parasympathetic. Okay? So if it's parasympathetic, if the drug mimics the action of the parasympathetic, it's parasympathomimetic. What is the action? It inhibits the heart, it constricts the bronchi. So that's why the responsibility of the nurse when giving this anesthetic drugs is to monitor the vital signs, specifically blood pressure, cardiac rate, and respiratory rate. Because eventually, the anesthetic effect may deprive, or may cause a possible effect to inhibit, to slow down the heart, to constrict the bronchi, and possibly this may lead to the chances that may affect oxygenation. So what we can now validate or justify now that why do we need to monitor the vital signs of the client 2 hours after operation, every 15 minutes, every 30 minutes, after an hour, every hour, then the next is every 4 hours. Why considering most frequent checking at the first few minutes after surgery and post anesthesia effect? Because of the effect of the drug in the parasympathetic on these two, inhibiting the heart and constricts bronchi. Another is most of the anesthesia, anesthetic effect is it stimulates salivation. Kaya that's why when the patient are being considered in giving this drug, it will also check magkukos yan ng increased salivation and pwedeng it may cause the obstruction of the airway. So that's why usually for patients who are on general anesthesia, the client will be placed with the tube, endotracheal tube, and that will facilitate also the suctioning so that to prevent the aspiration of the saliva. So this will give us the idea that action of the drugs affect each other if it is parasympathetic and sympathetic nervous system. So this concept class, I suggest that you need to not memorize, that to put it in heart, that this is very important as you go on with your journey on the higher level in nursing and at the time that you will practice nursing. So this is very much connected. I am really saying this 100% connected in the action of drugs, specifically on mechanism of action. So other than this, class, this will now apply yung use of agonists and antagonists. This will now apply the use of inhibitor and blocker. Okay, the table that you are witnessing now is the one that will really guide you on the specific use of these drugs. Kasi aside from the mentioned drugs that we studied in the common suffixes, in some drug handbooks, these are the classification of drugs that they will indicate. Kasi somehow you may be confused. Sir, you have mentioned about the common suffixes and those are the classification of drugs, but why we encounter different classifications? So this is what I am telling you. That's why it's very important also to have the mastery of the concept of parasympathetic and sympathetic nervous system. As what I have told you, when it comes to the parasympathetic nervous system, it is also called as cholinergic. Sympathetic nervous system or sympathetic is also called as adrenergic. The neurotransmitter is acetylcholine, and we have for sympathetic norepinephrine. So, these are the common drugs that if we say sympathomimetic, the action of the drug is similar to sympathetic nervous system. Parasympatholytic, class, we have used lytic. So if we use lytic, it means that if it will inhibit the action of the parasympathetic, it will have sympathetic response. It is also called as adrenergic drug, simply because the term adrenergic is associated with sympathetic. Cholinergic antagonist. Cholinergic is identified as parasympathetic since it use antagonist, di ba pag antagonist, contradict. So since it contradict the cholinergic, obviously the action is sympathetic. Adrenergic agonist. If we say adrenergic agonist, we use it as to stimulate. And if we will define this, it stimulates the action of the adrenergic, sympathetic. Adrenergic enhancer. Enhance. Enhance meaning stimulate. So since it use enhancer, stimulate adrenergic, sympathetic response. Cholinergic inhibitor. Just the same as for antagonist, inhibitor, it contradicts action of parasympathetic or cholinergic, sympathetic response. Cholinergic blocker, so similar as what I've told you, antagonist, inhibitor, blocker are synonymous to each other. Sama na natin yung lytic. Lytic, antagonist, inhibitor, blocker are similar or synonymous with each other. And if you use also anti, that will clearly identify the classification of drug. Next, if we use the term enhancer and agonist, stimulate. So just similar also with the parasympathetic response, later on we will have an exercise. Parasympathomimetic drug. It means that the drug mimics the action of the parasympathetic nervous system. Mimics. Again, parasympathetic is the normal physiologic. Parasympathomimetic is the term associated of mimicking the action of parasympathetic response. Some sympatholytic, since lytic contradicts sympathetic nervous system, parasympathetic. Cholinergic drug, since cholinergic, another term, parasympathetic. Anti-adrenergic, meaning it contradicts adrenergic effect, anti-parasympathetic. So in here, we have used agonist. Cholinergic agonist stimulates cholinergic, other term for parasympathetic, parasympathetic. Adrenergic antagonist. Antagonist contradicts the adrenergic, contradicts the sympathetic, parasympathetic. Cholinergic enhancer. It enhances the cholinergic, parasympathetic. Adrenergic inhibitor. It inhibit the adrenergic, kinontra, yung sympathetic, obviously, parasympathetic. Adrenergic blocker. Adrenergic blocker. We have, it blocks the adrenergic response, parasympathetic. Now I will have some exercises. For example, I will give an example. Let's go back to the slide in this area. Go back to the slide. The drug, okay, the drug action dilates the pupil. Okay? The drug action dilates the pupil. Then let's go back to this one. Choices. The drug action dilates the pupil. Is it letter A, sympatholytic drug? Is it letter B, cholinergic drug? Is it letter C, anti-adrenergic drug? Or is it letter D, adrenergic enhancer? Again, the drug dilates the pupil. Which of the four choices is the classification? Can I hear an answer? Who raised the hand? Yes, Mr. Han. So the answer is letter D. Your answer is letter D, which is adrenergic enhancer. Let's go back to the slide. The action of the dilation of pupil is sympathetic. So that's why when the drug will be classified, it will be either or any of this from the list. That's why I even mentioned in the choices, is it sympatholytic, cholinergic, anti-adrenergic, or adrenergic enhancer? So obviously, the dilation of the pupil is sympathetic, then I must identify in here if adrenergic enhancer is sympathetic, so your answer is correct. Let's have another drug. The drug, example, beta blocker. Beta blocker tayo ha. The action of the beta blocker or olol is inhibits heart contraction. Again, beta blocker or olol acts to inhibit heart contraction. Let us now go back to this one? Is it letter A, sympathomimetic drug? Is it letter B, parasympatholytic drug? Is it letter C, adrenergic drug? Or letter D, is it parasympathomimetic drug?
D po.
So who answered?
Prestosa po.
Okay, Miss Prestosa, your answer is?
B po.
Your answer is letter D, parasympathomimetic drug, because the action of the drug or beta blocker is inhibits heart rate. Thus, you need to check any of this. If parasympathetic, it's parasympathomimetic is the answer, because most of the three that I have considered as choices are under the sympathetic response. So, class, actually, you may not memorize this. Why? Kasi for example, in a simple analysis, what's the difference between parasympathomimetic and sympathomimetic? Obviously, if you encounter sympathomimetic, it mimics sympathetic. Parasympathomimetic, it mimics parasympathetic. If it is parasympatholytic, lytic, it contradicts action of parasympathetic. Sympatholytic, it contradicts action of sympathetic. Adrenergic and cholinergic. Adrenergic is associated with sympathetic. Cholinergic is associated with parasympathetic. Then you indicated here anti. If it is anti-cholinergic, cholinergic is associated with parasympathetic. So you put anti, it contradicts the cholinergic. So obviously, it's parasympathetic. On the other hand, if it is anti-adrenergic, you will think it's contra-adrenergic. It means parasympathetic. So we may have other examples as well to be discussed as a self-assessment exercise on a succeeding discussion that we may have. Actually, when we talk about pharmacogenetics class, we have defined this as makeup genes. And when we talk about makeup genes class, we may have genetic drugs may have unusual responses that may be identified to genetic differences between individuals, because somehow each individual is peculiar and somehow may be identified with inherited diseases. So if we say inherited diseases, these are acquired from the generations or from your parents. So one of the examples that I mentioned to you are, example, do you know that diabetes can be inherited? It's genetic. It's genetic. So that's why if ever in the family you have diabetes, there could be greater chances also, or higher chances, that you may also soon may have diabetes. So what could be your preventive measure? So you need to have some measures that will control blood sugar. So class, a normal individual who may not have diabetes and other individual who may have inherited in the generation of chances of having diabetes, it may have a different response of the drug. Because for an individual who may have chances of inherited trait or inherited or familial disease such as diabetes, it may cause the possibility that the blood sugar level may directly affect absorption of the drug and even distribution of the drug. So this is just how the pharmacogenetic is being conceptualized when it comes to pharmacology. So example, di ba we always ask also of history of allergic reaction, hypersensitivity reaction, drug history. So example, do asthma can be inherited also? Namamana ba ang asthma?
Yes po.
Yes. So asthma, for example, there are some drugs that may not be compatible to patients with asthma because they are high risk of allergic and hypersensitivity reaction. So from a normal individual who do not have any history in the family of asthma may have different response for those who may have history, because chances that the higher risk of allergic reaction is for those who may have history of asthma. So those are the concepts that are very significant to be part of the nursing responsibilities. Now, we will now proceed to the last portion of the concepts of pharmacologies when it comes to pharmacotherapeutics. Okay. When we talk about pharmacotherapeutics, it's always, if you will encounter therapeutic, this is therapeutic to me. This is somehow good for me. Okay? If we say pharmacotherapeutics, the therapeutic effect is also the same as desired effect. You are giving the drug because you have the desired effect. And what is the desired effect? If, for example, based from the classification of drugs that we have mentioned, we have anti-anxiety drug. So obviously, the desired effect of the drug is related to anxiety. So that follows through with the pharmacotherapeutics. When we talk about anti-hyperlipidemics, the desired effect is to manage and to control level of cholesterol. So that is the desired effect. So actually, the mechanism of action is identified in pharmacodynamics, but if we will talk about indications, if you will see that in the packaging of drugs or medications, if it is indication, what is the therapeutic effect of the drug? What is the indication of the drug? What case or what treatment or what is the target treatment of medical or health condition does the drug is getting through? So that's why it includes the following. You may encounter these situations or these terms when it comes to pharmacotherapeutics. We have empiric, pag sinabing empiric drug, supportive drug, palliative drug, maintenance, most common, maintenance drug, supplemental, and acute. Let's start first with empiric. Okay. If we say empiric, this is the key term for this is yung therapeutic effect sa kanya is by practical experience or observation. Example, have you heard about advertisements of drugs na ang mini-mention nila na naging they mentioned that the good effect of the drug is based from what they felt, what they experienced. It's all about testimonial. But it did not follow through the clinical trials pa, or it's still on the stage of clinical trial. Kaya that's why at this time yung stage ng vaccine that it's being administered is still on the empiric level. Yung empiric, yung therapeutic niya, empiric kasi it is still under study. It's still not reaching clinical trial 4. It's still on the level of observation and gathering facts through practical experiences. So empiric 'yon. Another, those drugs that are being released in the market such as herbal. Okay? 'Di ba most of the herbal medicines are considered as supplemental drug, and it is usually identified as no approved therapeutic claims. That's why these herbal medicines or supplements may not directly advertise that it's a treatment for a certain health condition. Kaya that's why most of the release in the market is related to sa mga testimonies for those who have taken the drug, but not merely saying that they are being treated, they have been treated with a certain drug. So yun yung mini-mention nating what do you call this? Ito yung sinasabi nating empiric It's by observation, testimony. The therapeutic effect is based from the experiences. If the drug is still under study and still gathering facts, so may empiric observation. Kaya sabi ko sa inyo, the COVID-19 is still on the empiric. Nagpa-follow through pa rin siya sa scientific process, pero hindi pa siya totally complete. Kaya it's still on the practical experiences. Kaya that's why, di ba, usually we are guided with questions after we receive the vaccines na after the vaccination, did you experience headache? Did you experience this and this and this and this and this? Because it's still on the empiric level. So that's what we meant by empiric. Next, if we talk about supportive. If we talk about supportive, this is mainly related to the term sustain. Okay. Sir, ano po yung sustain? What's the difference? Let us now have the difference between supportive and maintenance. Maintenance, familiar kayo sa maintenance eh. Usually pag maintenance, before I proceed with supportive, I'll just give you already the overview of maintenance for you to have a clear understanding on supportive. If it is maintenance, usually, di ba, these are identified who may have diabetes, who may have hypertension. These are the identified diagnoses which merely a lifetime pharmacologic therapy is prescribed. Because these are situations which may not be resolved. That's why it's termed here chronic eh. Kasi chronic, long period and possible na lifetime na the person may have. It may not be treated but it must need to control. So yun yung mga maintenance. Kaya yung mga, if we say, did you take your maintenance? So regardless if the patient is hypertensive that time, he or she needs to consider to take that drug as maintenance because anytime he or she may have hypertension. So the purpose is to control because it's already chronic. Yun yung maintenance. Ngayon, go back tayo dito sa supportive. Yung sa supportive naman is to sustain but does not treat the cause. So example, if we say supportive, for example, the patient may have a situation like ikaw, for example, you will experience fever. Yung fever na yan is caused by the infection, right? So, yung supportive diyan, kasi pag supportive, other term diyan that we can use is adjunct supportive. Yan. So, for example, what are the signs that a person may experience if with infection? So, the patient may experience fever. So, parang ang supportive kasi dito, ang focus natin symptomatic. The focus of the drug is by symptoms. So, if the patient, for example, has COVID-19, hindi tayo directly nagtitreat sa viral infection. But we are supporting to give a drug to manage the fever. So, it will sustain the normal temperature. So, that's why we are giving paracetamol. We are giving paracetamol not to treat the cause, but merely to treat the symptoms. So, another situation, for example, the patient has another example. So sige, sa COVID-19 pa rin. Sa COVID-19. For example, the patient is experiencing difficulty of breathing. So again, the primary cause of the problem is COVID-19 infection. So since the patient is experiencing difficulty of breathing, for him to sustain normal breathing, okay, for the person to have normal breathing, I will focus na to manage yung kanyang difficulty of breathing by giving nebulization to open up the airway passages so that to facilitate yung mag-improve yung kanyang breathing pattern. So again, it's a symptom of COVID-19. but it's not treating directly the COVID-19. So again, the word here is symptomatic. Yung symptoms ang sinusupport natin to be given yung mga drugs that are intended for. Next, we have the palliative. If we say palliative, these are situation wherein the condition is the end stage. Chronic din ito pero end stage or terminal na. Kaya usually, a typical example here, cancer. If the patient is already diagnosed with stage 4 cancer, usually the doctor may not anymore subject the client for chemotherapy kasi the body may not perceive the action of the drug. So, di ba usually ano po just like for situations, ano yung what are the common signs or symptoms that a cancer patient experiences? Ano yung common sa mga cancers?
Nalalagas po yung buhok po.
Okay, so there is usually alopecia or yung hair loss. It's probably because of the concern na with chemotherapy, or unless dependent on the nature of the cancer, kasi pwedeng cancer cells are higher rather than healthy cells. Any other yung common experience na ng mga patients na may cancer at the end stage?
Sir,
Yes,
Ano
Ms.
po?
Tanghal?
Nag-change po yung skin nila.
Nag-change ang
Skin po.
skin? Pwedeng nag-change yung skin nila because of the possible parang it may not sustain anymore the hydration. Yung cells mismo actually is deprived already from the nutrients. So that's also correct. Yes, Mr. Reg.
Hindi po nag-heal yung mga sugat nila.
Yeah, so probably because of the delayed healing of the of the mga wounds or bruises. Do you think common sa kanila ang pain? Lalo na sa pag mga nasa terminal, yan. So common yan. So one thing that we may consider also, pwedeng weight loss yan, mga usual yan. Pain is the most common. So ang purpose natin kasi we cannot anymore treat the patient pag mga terminal na. Kasi 'di ba usually pag mga end stage na 'yan. Pag end stage ang example natin diyan, mga kidney failure. 'Di ba usually pag end stage na 'yan, usually it is expected na that they will continuously have the dialysis, the hemodialysis. But on the process ng hemodialysis, common sa kanila to experience pain. Common sa kanila sa mga end stage kidney failure ang maging anemic kasi ang kidney po ay may kinalaman din when it comes to the RBC regulation. So that's why most common sa kanila, 'di ba, dahil sa mga end stage na renal failure or kidney failure, usually bumababa ang blood level nila at most sa kanila ay anemic. Some of them may have blood transfusion. Ngayon, since I have mentioned na most common sa mga patients na may end stage at terminal pain ang pain, we may not anymore focus on the end stage of the disease, of the disorder, but moreover, i-alleviate natin na lang yung mga symptoms na nararamdaman ng cancer patient. So, example, most common sabi natin is we have pain. So, probably, palliative care na natin kasi long term na yan. Alleviate na lang natin. If the patient may have pain, then give pain reliever. Pero it may not directly resolve yung problem with cancer. So, another is, if it is weight loss, it could be only supported by intravenous fluid. So, but it may not directly resolve yung problem sa end stage at saka terminal. So sir, ano nga po, i-differentiate nyo nga po yung supportive sa palliative. Yung supportive kasi, for example, di ba sa example ko sa inyo, yung COVID-19 nag-cause ng fever. So yung COVID-19 nag-cause ng fever, hindi natin tinitreat yung COVID-19 pero yung symptoms ang nire-resolve natin, yung fever na caused by the infection. So as much as possible, sustain, ibig sabihin sustain, pag ang person undergoes the treatment at hindi na siya na-experience ng fever, ibig sabihin the paracetamol is not anymore needed. So sustain, ibig sabihin I gave paracetamol, na-sustain niya na yung temperature niya. So paracetamol may not be needed. Pero unlike kasi sa palliative, pag mga end stage, terminal stage ng disease, expect mo yan anytime, may pain yan. Kasi end stage may pain yan. So that's why ang purpose na lang natin, i-alleviate yung pain, ibaba yung severity of pain. So yung maintenance naman, we're talking about primary treatment. Supplemental is related to the, supplemental naman is prevention, replenish, substitute. Kaya sabi natin, pag supplemental, mostly identified yung mga supplemental sa mga multivitamins, herbal drugs, na sana may FDA approval. Prevention ito. So kaya nga sabi natin, most of the supplemental drugs are no approved therapeutic claim. So it's not used for treatment but it's only used for prevention. Kaya if ever sasabihin natin na ang ascorbic acid ba ay treatment for COVID-19, hindi. It may not be claimed as that because it's just only supplemental to boost immune system. Prevention. Another. Why multivitamins are taken? Because it's preventive, because the body of a person who may have infection may not control loss of vitamins out of the body. So that's why it will supplement what is being lost. So supplemental. Another, some of you are taking some of you are pag mga dehydration, may experiences ng dehydration, sasabihin, you buy Gatorade. Replenish. Pero class, try also to take into consideration ng mga Gatorade kasi ang problem naman natin with Gatorade, baka mataas yung sugar. Check niyo yung sugar level ng ingredients. Kasi pag mataas yung sugar level, baka hindi rin makatulong siya pag masyado mataas yung sugar kasi mataas yung calories. If mataas yung calories, it may also cause the loss of the fluids out of the body kasi hypermetabolic activity yung body. So much better talaga, the best talaga ng replenish is water. So substitute siya sa mga nawawala out of the body. So yun ang supplemental. While we are talking about acute, okay, pag acute naman, these are the term that are being used here are critically ill. So ito yung pag-acute kasi, that's the difference between the chronic. Pag chronic kasi it's usually the disease are being identified that longer 6 months onwards na or pwedeng lifetime na. Pero pag if we say acute, it's in the early stage. These are the drugs that may be given as acute intensive therapy. Ano example natin dito for acute intensive therapy? Ano yung mga critically ill? For example, ang patient natin are considered as critically ill kasi may complications. So yung complications na yon, yung mga drugs that will treat the complications are being identified for being therapeutic as acute. Kasi kaya nga intensive Kaya if you will hear intensive care, those are the individuals that will need further monitoring. So may complications yon, may complications. So those drugs that are definitely directed to manage complications. So usually yung mga therapeutic steps that I posted here is related to, you need to identify the nature and extent of patient's problem, if it is preventive. Plus sometimes you may encounter also prophylaxis. Okay. Pag nakadinig naman kayo ng prophylactic drug, preventive din yon. Okay? Prophylactic. Example, sometimes you are being advised to, when you're exposed to floods, Oh, mamaya you have the open wounds. And we all know that the source of the leptospira is with the urine of rats that may be present in floods. So for you to prevent leptospirosis, take doxycycline. So it means you are not diagnosed with leptospirosis. But why the doctor is giving you doxycycline, which is an antibiotic, preventive. So that to prevent the leptospira to go with the circulation and may cause infection. Remember class, ang leptospirosis, ang target niyan kidney. Kaya very crucial. Very crucial. Once you may have leptospirosis, ang punta mo NKTI agad, National Kidney and Transplant Institute. And most of worst conditions may be subject for dialysis. So going back to the situation of giving doxycycline, the person may not have and diagnose leptospirosis, but doxycycline are given prophylactics. Kaya if you will encounter the term prophylaxis, it's for prevention also. So we need to assess the therapy options, kasi the therapy options could be also depending on the condition of the patient. Kaya we identify if it is terminal ba siya, acute ba siya, chronic ba siya, or somehow a lifetime identified familial disease. Selecting type of therapy, kasi dito ito mga therapy to empiric therapy, supportive therapy, palliative therapy, maintenance therapy, supplemental therapy, acute therapy. So the selection of type of therapy may depend on the condition of the client. So that's why pag sinabi natin chronic conditions na hindi nare-resolve, so maintenance yan. Mama, pag sinabi nating maintenance, these drugs will be taken na throughout your life na. So pero pag sinabi nating palliative, it will just only alleviate it will just only alleviate yung present situation siya, pero most common na mas may experience, so para to provide comfort na lang. Pero yung supportive kasi pwedeng one time na experience pero ma-resolve siya agad through a drug, so ma-sustain. So yung empiric is by observation. We are still gathering facts, and we just gather the facts based from the therapeutic effects based from practical experiences. So implementation of therapy and monitoring of effectiveness is very important. So I think I already exceeded the time that we have agreed na supposedly it's 7:30. So I will stop the discussion this time.